Welcome back. Well, as Africa, including Namibia, navigates important demographic changes, understanding how best to support aging populations has become a growing priority for health systems and policymakers. The International Seminar on Aging in Africa was hosted by the University of Namibia at the Hage Geingob Campus and presented key findings from the Pan-Africa Utilisation of Lay Assessment Systems, or PAULAS project, a multi-country study examining the physical and mental health needs of older adults across the continent. Joining us as one of the keynote speakers, that is John P. Hirdes, University Professor at the University of Waterloo and a globally recognized expert on aging and health systems. He's here to share insight on what this research means for Africa and how countries such as Namibia can prepare for the future. Professor, good evening and thank you so much for being here.
Thank you for having me.
And welcome to beautiful Namibia.
It's wonderful to be back.
Well, Professor, just to start with, from your global perspective, why is it critical for African countries to focus on aging populations right now?
Well, the whole world is getting older, but Africa is aging at twice the rate of other countries, of high-resource nations. And it's happening at a faster rate than it happened in Western Europe or North America. And the challenge with population aging is, first of all, it's a success. It shows that the health system is working, that we can live longer. But as people get older, their health needs become more complicated. So the health system has more complicated challenges to deal with, and therefore must take a different approach to meeting the health needs of older persons.
And what were have you found are the contributing factors to African countries aging twice as much as compared to our global brothers and sisters?
Well, part of it is change in fertility rates, and then survival into later age is what drives population aging. But what's also interesting in Africa, we did a study in 14 different African nations, and what we see is tremendous diversity in terms of the health needs of the population that's there. So older adults are more likely to have issues with disability, complex medical conditions, mood and depression-related symptoms, pain is more common, but you see variability between the African countries that were involved in our study. And so we have to sort of think about how do you respond to the individual person's needs, not just think that one solution will fit everybody.
Right, right. Briefly explain the PAULAS project to us and what motivated this multi-country research initiative.
Yeah, the United Nations Decade for Healthy Aging has issued a call for all countries of the world to, as part of that strategy, do a comprehensive assessment of the health and social needs of all adults over 60 every year in their country. Now, if we look at health human resources in most African nations, there aren't enough nurses and physicians to do those assessments.
Right.
So our project is looking at using community health workers to do a self-reported assessment with older persons in 14 different African countries that all vary in terms of the level of wealth and complexity and challenges. And so our first approach is to see, can we do this successfully? Can we get good data with it? And can we use that to identify health needs of older persons? And the project has been extremely successful so far.
Talk to us about some of the most important findings in terms of the physical and mental health needs of older adults across Africa.
Right, so in terms of mental health needs, the most important mental health need would be depressed mood. And you see huge variability. So for persons that are in stable African nations with good resources, the rates of depressed mood can be around 10 to 15%. But if we look in countries that are experiencing conflict, the rates of depressed mood are much higher. Pain is a very common issue in older persons. So more than half of the persons that we studied had experienced some level of pain that wasn't being treated adequately. And then medical complexity is a very important thing. As people get older, they become more frail, which means that they can't withstand challenges to their health as readily. And so the rates of frailty vary substantially between countries. The challenge with frailty is it's not just one problem. So a doctor can't give you a pill for frailty. They have to think about preventive interventions, rehabilitation, medical treatment, psychosocial interventions.
Yes.
It's a challenge to deal with.
Yeah. You mentioned earlier some of the drawbacks or challenges that, the older generations in Africa face, but how do these, challenges that, the older people face in Africa compare with other parts of the world?
So some of the issues are more prevalent. So mood disturbance and pain was more prevalent than I see in a Canadian sample, for example. On the other hand, when it comes to physical mobility, in many cases, older Africans may be better off than older Canadians because everybody walks everywhere, and walking is a good form of exercise to keep you mobile and fit.
Right, right. What practical lessons, Professor, is it that Namibia can draw from this research when planning health and social care services for the aging or the elderly people?
Well, I'll bring you back to the UN Decade of Healthy Aging requirement that every older person be assessed for the health and social needs. What this study shows is it's feasible to do in a cost-effective way. The data quality that we got from the assessments is the same as an assessment done by a professional nurse in a home care agency in Canada, and that was with community health workers, in some cases quite poor nations like Malawi, and the results are very encouraging. It means that there's a cost-effective way to meet those objectives of the UN Decade of Healthy Aging.
In your view, Professor Hirdes, how can communities and not just governments, play a role in supporting healthy aging?
There's a variety of things you can do. You can think about making age-friendly physical environments. So thinking about sidewalks that are safe to walk on, or roads that are comfortable to walk on, having places to rest if somebody is tired, thinking about lighting, making sure that folks have a sense of security and comfort. And building a sense of community. Loneliness and social isolation are important problems for older adults, and that can affect depressive symptoms. So making sure that everybody takes care of their family and of their neighbors as a community is something that we can do. And then with these assessment methodologies, it gives physicians and primary care nurses the information they need to understand the complicated needs of the older person, so that they can take a multi-dimensional approach to meeting that person's needs, either through preventive strategies, rehabilitation, or treatment as appropriate.
And what policy shifts or investments, Professor Hirdes, do you believe are most urgent to ensure quality and, of course, dignity of life for older adults?
Well, we have to be ready to invest in care of older persons as a strategy going forward, because very quickly that population could overwhelm the health system if we don't respond to it effectively. Older persons don't respond to medical treatment as quickly as younger persons. They have more complicated needs, but they still need their dignity and their health to be taken care of. So being sure that you're prepared to meet in a cost-effective way is a huge priority. Africa has less than half the time to prepare for population aging than Canada did, for example, because the rate of change is so fast.
Well, in conclusion, what message is it that you'd like to leave with, policymakers and the public about preparing for an aging society?
Well, aging is a sign of a successful society. That's the first thing. So having an older population is a good thing. That's what we want. We all want to live a good older life. And what our PAULAS project is showing is that we can deal with population aging in Africa in a cost-effective way that is manageable with the resources that are available in the health system. So I'm very optimistic about the ability of countries in Africa to deal with population aging appropriately.
Professor Hirdes, it's been insightful and lovely having you with us this evening. Thank you so much for your time. We appreciate it.
Thank you for having me.
Our conversations will continue after this very brief break. Do stay with us. You're watching the Daily Roundup with Nina.